gonna go kind of into the details of what questions we're gonna be asking you during the consultation. We need to know what medical problems you have, what medications you have, and what previous surgeries you've had. We just need to make sure that we know all these things to make it as safe as possible for you and know what things we may have to treat specifically. We're also going to want to know your pregnancy and childbirth history, whether you've had weight loss in the past, and if you have any plans for future children, because that's all going to affect our process. After we then go through some of the preliminary discussion with you, we'll have you go ahead and change into a gown. Whenever you change into the gown, we will then come back and do an exam. What I'm looking for is where you have extra skin, how much extra skin you have, if you're having any rashes or wounds from that, where the excess skin is coming from, whether it's all in the vertical direction or if you have some of that extra in this direction as well. We're also looking if you've had any scars in the past. We're looking for any hernias and areas that you have a little bit of excess fat. I'll then let you know if you're a good candidate for a tummy tuck and whether you're going to have a good result from the tummy tuck. Now with tummy tuck scars, we usually keep them nice and low, so I will show you kind of where in your bikini line it will lie. We also want to know what type of underwear or bikinis you like to wear, because then we can fit that scar right into that line. I'll also discuss with you that we're going to do an internal corset, meaning that we're going to tighten those belly muscles that may have been stretched out from pregnancy or weight gain, and we do those with sutures to kind of bring those muscles back together. And then for most of our patients, we'll perform liposuction of the side flank area to give you that nice curve with your hips. We will go through kind of all of those different options and see what is the best plan of action for you. So some of the things that our patients ask us about with tummy tuck are extra areas of liposuction. So a lot of my patients that have some of that kind of back fat area, we can't reach that with just the traditional tummy tuck because you're laying down on your back on the operating room table. And so to really get that cinched in waist look, sometimes we'll have to flip you onto your stomach to do back lipo. So if that's something that you're interested in, make sure to ask me about it. If you have extra skin of kind of your side saddlebag area, ask me about that, because we can add in a lower body lift or even a back belt lipectomy. And then also a lot of our patients are now interested in fat transfer to the buttock. And the reason why is because a lot of patients, as they get a little bit older, they've had children, they've had weight loss, they develop kind of what we call hip dips right here. And so their hip doesn't have a nice curve in and then out right there. It kind of has this lumpy bumpiness throughout. And so what we can do is transfer fat to your buttock hip area to make that curve go in and then out, to make it a nice smooth transition rather than having in right here and then kind of this like lumpy bumpy down. Some of the other areas that our patients ask us about are breasts. So if you're interested in a breast lift or augmentation, go ahead and ask me about that. And then a lot of our patients are also interested in arms or thighs. Arms we can do at the same time, thighs we cannot. The reason why is because whenever I'm doing a thigh lift, I'm pulling everything up and wanting to suspend everything up, and whenever I'm doing a tummy tuck, it's pulling down and pulling up here. So we have two forces working against each other. It just causes wound healing problems and increased complications that I'm not willing to put you at risk for. So in surgery, you'll have the scar line down here. Most of my patients will get 1 to 2 drains. Very rarely, I can do a drainless abdominoplasty. The reason why is I tend to be a little bit more aggressive on my liposuction. Whenever I do liposuction, I inject fluid in and don't suck all that fluid out. So the majority of drainage that you're going to have is from that fluid, from the tumescent fluid that I put in for your liposuction. So a lot of my patients still have just too much draining for me to feel comfortable doing drainless abdominoplasties. And so I'd rather just have a little drain in there for a couple days and take that out rather than having a seroma that can affect your overall outcome. On one of the videos below, you will see some of the FAQs about tummy tuck. But the other thing that I want to talk about is liposuction, where we can and where we can't do liposuction. So basically, if you draw a line from your nipples down, anything in between there It's something that we're not going to liposuction during your tummy tuck. It can increase your risk of having wound healing complications and all those kind of things. So again, I just want to do the safest thing for you, decrease the risk of complications so we can get you that nice snatched in hourglass waist. But some of this fullness up here will get pulled down and we excise it directly, but we're not going to put you at an increased risk of wound healing complications.